Good morning, all of you people who are here the day before a beautiful 3-day weekend. You're getting in your vegetables before hopefully you have a nice long sunny weekend of dessert with friends and picnics. There is a lot happening as there is every week, so I am just going to kind of start and move through. And I want to let people know that next week we should buckle in because that's the first week of September, and that's when Congress comes back. So we can probably start to anticipate that some of the things that we've been talking about in August will start to actually move forward and happen. So there may be more to follow in the weeks ahead. So one significant development that occurred yesterday is we are getting a clearer and clearer picture of what are the impacts that are starting to happen to states and state budgets from the July 4th reconciliation bill, which I'm going to start referring to as HR 1, which stands for House Resolution 1. That is the official title of the act. It's the first act that was passed. So when you see HR 1, that means the reconciliation bill that was passed in July. Yesterday, the Department of Health Services calculated that there will be at least a $70 million shortfall in this 2025-2027 budget cycle. Remember that budget that passed the state legislature just 12 hours before HR 1 was signed. That's at the time what we thought we needed for the next 2 years. And we knew that the changes in the federal bill, which would make cuts to programs and also mean that states have to do things they don't have to do now, would create additional costs or additional gaps in the state budget. Now we're starting to see the first wave of that happening with SNAP. And those extra costs are being calculated really from 3 changes. One is there's going to be a lot more people who have to prove they're working or exempt from SNAP work requirements. And most of what the Department of Health Services is calculating the cost of that is an increase to the existing food share employment training program. I don't believe that reflects the additional costs of if you have to serve many more people potentially and make sure that you are verifying that what they're reporting is correct, etc. I'm not sure that that $14.6 million includes the cost of system upgrades or training additional, training workers to be able to, help more people successfully navigate food share. So again, it's an at least calculation. Another place where there's extra costs coming, we've talked about right now, the federal government pays states about 75% of the cost to run food share. That's going to change. And it's going to change in next year as of January 1st. So instead of 75%, the federal government is going to provide 50%, which means the state has to pick up the amount the federal government has decided it's not going to pay anymore. So now states, instead of 25%, have to pay 50% of the cost of running food share. And that amount is $43.5 million for 2026. That number, in fact, is going to continue to increase in future budgets because the amount the federal government will contribute to run food share will go down again in 2027. So that means we could have kind of a double whammy, not only this budget cycle, but ongoing. And then the third place that those extra costs are coming from is in making sure there is more people who are keeping error rates low. And that's important because HR 1 penalizes states that have error rates above 5%. And so if states want to avoid having to pay a certain amount of the total cost of SNAP, they want to keep their error rates low. Wisconsin currently has a low error rate, but they're saying, hey, we need a lot more money to make sure that that error rate stays low, because if we end up having an error rate that's higher, it's going to mean a lot more cost than what we've calculated for SNAP. So, as I said, this is really an initial estimate. Those numbers can change, and they will continue to increase, not only in this budget cycle, but the next. The immediate issue for the state is that those work requirements in SNAP, all of those changes, and remember, we now have a larger age group who are subject to those prove your working requirements. We've had exemptions that were removed under the bill, and there are not going to be exemptions for certain places who have been exempt before because they just don't have enough jobs for the population. That all four of those things mean that there are more people in food share who are receiving food share now who don't have to do and verify work requirements who will. And HR 1 didn't have a implementation date, which means in theory, the implementation date is the date the bill was enacted, which is July 4th. So that is part of the reason why Wisconsin is thinking about, well, how much will this cost to implement? Because they will have to implement in the real near term, because of the bill didn't give them any time. And you can see, this is from the food share data dashboard, that there are a lot of people, about 67%, 2 out of 3 people in food share are also on Medicaid. So it is the same groups of people who are being impacted. The impact on food share comes first, and we'll talk about Medicaid in a little bit. The DHS has put together a web page, and you see it on the screen here, that is trying to track the different provisions, both Medicaid and food share, that they think will impact the state. So there is a section on Medicaid on that web page, and they don't have enough information to do any projections about what those changes might cost the state. CMS has not issued guidance yet, so the state doesn't know what it has to do and what it can decide for itself to do. We do know that there will need to be a lot of work in the next year to prepare to implement the Medicaid prove you are working exempt requirements. And remember, last week we talked about CMS being very clear with states at a conference that there wouldn't be extensions. They would not be granting any potentially waivers to give states more time to implement those work requirements. So that means that by the end of next year, our state and every state will have to have a system in place that's ready to go live as of January 1st, 2027. Well, that means that in 2026, that's your window to do all of that work. So we can be sure that while $70 million extra money that our state budget didn't account for is needed for SNAP, there will be other waves of impact that will occur that will keep affecting the 2025-2027 budget if the department doesn't have enough money to do the things it needs to do to upgrade the systems to get ready for what needs to be in place by January 1st, 2027. A few articles from around the state. Again, it's really important that people keep saying the things that we have been saying for the last 9 months. And this article has a really nice example of a family member of a person with a disability who happens to work with other clients about what these cuts will actually translate into in people's lives. And I think that that's really the drawing and connecting the dots between this is what it means in somebody's experience is really important. And you can see, especially in the last paragraph, that's what's happening. There are a couple of Wisconsin-based articles that just came out yesterday and today about what the ACA marketplace changes. And remember, there are several layers here. The HR1 did not extend the federal money that keeps premiums low. There are also rising healthcare costs. There are also some tariffs. And there's also an administrative rule that was passed in July that are all going to contribute to making ACA marketplace premiums a lot higher for people next year. And over the past few weeks, we've kind of followed some of what the rate increases are proposed to be in Wisconsin, and they are pretty high, ranging anywhere from 6.6% to more than 30, almost 35% premium increases. And then, of course, those increases may not be the same for all individuals because, depending on where you live and your age, your premium might be higher. So this article does kind of a good background of how many people in Wisconsin are potentially being affected. And you can see that perhaps as many as 50,000 or more people who live in our state may lose their Affordable Care Act marketplace coverage because of these changes. And that's coming from our friends at the Wisconsin Office of Commissioner of Insurance, who kind of, they're the state agency that is really overseeing insurance plans. So they're pretty deeply paying attention to this issue. We have about 313,000 people in Wisconsin who have an ACA marketplace plan right now. So when you think about 50,000 or more, that's actually a lot of people from the overall pool who might be losing their healthcare insurance or be unable to afford it if everything stays the same 3 months from now. A second article came out today, and I really like this one because I think it makes it pretty real. So if you're looking for something to share or weekend reading, this is a really good one. And it begins by showing some very different people who are impacted by ACA marketplace changes, including, small business owners who really can't afford to provide employer-sponsored insurance, and they have lower paid employees who are really trying to get their coverage from the marketplace. In this case, it was a child care center, not dissimilar from the situation that many personal care agencies and home health agencies and direct service personnel are also in. A lot of these are smaller businesses who may not be required to offer plans or couldn't afford them even if they could, whose workers have a low wage and then no benefits. Another person, and you may recognize this person because she's our current board chair at the Board for People with Developmental Disabilities, is an example of people with disability, a person with a disability who is, doesn't have social SSI anymore, which was her pathway to qualifying for Medicaid, because she's so functional. She can work, which is great. She can work, and she's working 2 part-time 20-hour jobs, neither of which provide health insurance. So those subsidies from the ACA are the difference between her being able to afford a plan and not afford a plan. And there are a lot of people who are in this category of, they have significant long-term disabilities, but they haven't cross the threshold of qualifying for SSI. And so these are exactly the kind of people, and there are many of them, who are kind of caught between a rock and a hard place often, and could be caught in a hard place if they're trying to figure out, am I exempt from Medicaid work requirements and some of the other changes that we've talked about. There's also a really nice example of a person with some chronic conditions that cost a lot to manage. And she was just very candid about, well, here are the things, the medications and the treatments that I am on and what they cost per month. And I'm having a really hard time affording my medical expenses right now with the way the things are now. And really just clearly saying, like, if I get less subsidies or my cost share goes up, that's the difference between me being able to have healthcare or not, and what happens if I can't afford it. Again, our friends at the Office of Commissioner of Insurance, and I'm highlighting this piece because, states are starting to feel the impacts and in kind of waves of these federal policy changes on their state budgets. And one piece that could be coming for Wisconsin is, we have a healthcare stability plan. I think we talked about it several weeks ago, and that helps keep premiums low because it's a fund which state money and federal money goes into, and it helps insurers cover the costs of higher risk people, keeping everybody's premiums lower. So the state budget has fully funded its part of the plan, but the amount of federal money that's provided is based on a formula. And it's based on that, part of how that formula is calculated is based on the size of the marketplace enrollment. Remember 2 slides ago when the same Office of Commissioner of Insurance person was saying these changes could cost us 50,000 or more people coming out of the marketplace? If that happens, that means that there's less federal funding that's contributed to the stability fund. And if that happens, then this is another example of where the state will have additional costs it hasn't budgeted for, that it will have to find from somewhere to either keep that program fully funded. We've also talked about, who leaves the marketplace may be those people who are the lowest cost members, the younger folks who have less costly conditions. So in that sense, every person who leaves the marketplace has an impact in terms of that federal formula. But if the people who leave the marketplace are also the lower cost folks, that means that stability plan is trying to cover the costs of more and more older and higher cost individuals. And that will increase the amount of money that's needed for that stability plan if you want to keep premiums lower than they would otherwise be. So again, just another further impact on a state budget. I referenced a rule that made a lot of change that were supposed to go into effect and make changes August 25th, which was this week. Wisconsin joined a lawsuit with, I think, 20 other states and said, hey, this rule is going to make it a lot harder for low-income people to get or stay in marketplace plans. Wait a minute, let's not be hasty here. Well, a federal court has blocked temporarily the implementation of that rule, just based on the plaintiff's assertion that 2 million people are going to lose their coverage because of increased fees and other barriers. And this ruling actually is not in response to the lawsuit by the states. There were several cities who sued. So, we have not had the lawsuit that Wisconsin joined resolved yet. Again, the way these things have been working through the courts, it gets confusing because we have a temporary pause here, which does not mean that this rule will not go into effect. It means it's not going into effect right now. And once this case is decided, that may impact how the next case is decided. So it's still a mess, and it's still unclear as to how this rule, what will be allowed to be implemented and when. But there has been a pause in at least the things that were going to be going into effect this week. There's an opportunity, if you've been tired of submitting letters to the editor, now you can submit some public comments on a federal rule. A few weeks ago, we talked about that there are a number of federal administrative rules that are being either changed or rescinded. This is another example. In 2013, we finally extended minimum wage and overtime protections to home health aides, personal care aides, and direct support professionals. Prior to that, there was no guarantee of a minimum wage or overtime protections because these particular workers are classified as domestic workers and are talked about in the context of providing companion services, which doesn't fully reflect the actual jobs and healthcare tasks that this group of workers actually does. And that was the policy that was in place in 1975 until 2013. The rule that they want to change would take us back to the 1975 policy, which would mean there wouldn't be minimum wage guarantees or overtimes for these groups of workers. So public comments are due on September 2nd, which is next Tuesday. There's a link to the Federal Register, and you can click the button and provide comments. Our organization will be providing comments, and this is kind of an excerpt of what we've said if you are looking for some language to kind of copy paste, etc. If you are commenting, I think it's always a great idea to talk about what the work is that these folks actually do. And many of you have been very elegant about saying over and over again, these workers are not fully, like, the work that they do is not reflected in their wages or benefits. So why would we want to add on, more reasons for good people to not do this work, right? So I'll let you guys kind of tell your own stories there, but I think it's important for the Department of Labor to understand that this is not a change that is going to be helpful to a workforce that already suffers from too few workers and high turnover. We're making progress on our survey. We're actually about 40% of the way to our goal. I forgot to change the slide, but we could use a lot more responses. So we'll probably have it open for the next couple of weeks. If you are, taking a break over the holiday, and this could be your first message out to all of your friends on next week, we would really appreciate as many people filling it out as possible. Congress. So here's our timeline. And I'm not going to spend too much time on this slide because I think this is an easier thing to understand. Congress is coming back next week, and there are lots of things that are potentially all happening in a relatively short amount of time that could result in more cuts to federal programs or more actions by this administration that delay or affect funding that is supposed to come to states. And just to summarize, the 2026 federal budget, that needs to be, something has to happen on or before September 30th, because that is the last day of the federal fiscal year. And so either Congress figures out how to pass the federal 2026 budget do a continuing resolution that keeps, makes some funding decisions, and gives themselves more time to work on the full budget. Or if they can't do either of those things, the government, shuts down many discretionary programs. Funding for those shuts down on October 1st. So we are now at the point where we are starting this high pressure timeline of, okay, Congress, now you have created a crisis that does need to be resolved in a relatively short amount of time. And there are certainly some strategies Congress has talked about. The 2026 federal budget could mean spending cuts to existing things that the federal government is funding now. Remember, the Senate and the House have very different ideas about what should be funded, and the language has to be the same between the Senate and the House in order to get something passed. There's certainly been a lot of discussion of education and housing being two places where there might be some significant cuts proposed. There's also been discussion of, maybe using earmarks or funding for specific projects, which could mean taking funding away from something else, so that there's, you can convince members to vote on things. So this is kind of a Wild West situation of, you've now got, starting next week, less than 28 days to figure it out. We have not heard more about rescissions or formal deferral requests being sent to Congress, but there's certainly a lot of pots of money that were appropriated in 2025 that have never made it to where they are supposed to go. And now we are 28 days from the ability to spend that money expiring at the end of September. We still have conversations that have been ongoing throughout August about what to put in a second reconciliation bill. Congress could choose or not choose to act to extend those ACA marketplace subsidies. The first bill, HR 1, made deep enough, created enough of a spending imbalance where it actually triggers automatic spending cuts. Those are called sequestration, and Congress has to do something to avoid those sequestration cuts, if that's what they want to do, by December 18th. And then there's kind of ongoing things that I think will continue to be something we will be talking about over the next year. We have a current administration that has been doing a pattern of withholding federal funds appropriated by, Congress. So, even if Congress makes spending decisions, that doesn't necessarily guarantee that the money makes it to where it's supposed to go if Congress is going to continue to not hold the administration's feet to the fire and make sure the money actually is released. There's also a new pattern, maybe not new, but it's becoming more common, where the administration is kind of trying to set up conditions that it wants states to agree to in order to get federal funding that was appropriated by Congress. So those are both strategies that we could see as being potential barriers for states actually receiving money, even if it is appropriated. This is less of questions as it is comments, but if you put, can you commit to fund and you'll get to a question. And I think these are points that are very relevant for the next, month and a half and 6 weeks that we are going to be entering into. And already we are kind of seeing some signs that Congress is gearing up to have some hearings. There is a hearing scheduled for next week, Thursday, before the Senate Finance Committee. Secretary Kennedy has been called to testify, and it's specifically about what's the president's 2026 healthcare agenda. Some of you may have been following in the last day and a half. There's been some pretty significant changes to the Centers for Disease Control, which, among many things it does, has a role in vaccine recommendations. That could be one of the topics that is covered there, but many others. There's also been a lot of discussion about what kind of additional cuts to Medicare or changes to Medicaid are being proposed by that agency. So that is a hearing to watch. Not sure what will happen as a result of it, but it is an opportunity for senators to really ask questions and hear from the secretary and try and get on record what is the plan. The Democratic ranking committee member in the House Education and Workforce Committee has put out a report too, which gives a pretty good summary of all of the disability programs that might be in the crosshairs of some of these funding discussions, and how not only the administrative changes to the Administration for Community Living, but the cuts to Medicaid and HR1 and other regulations are impacting people with disabilities specifically. So it's a pretty long report, but I think it kind of does give you a good overview of here's a lot of different things that are happening at the same time, and specifically how they impact people with disabilities. Moving to the administration, I talked a little bit about Wisconsin having, done some initial estimates on here's one set of changes on one set of federal programs, SNAP, that is going to impact our current state budget. We will have to come back and figure out how to fill that budget hole. Well, we're not the only state that is having those discussions. Colorado is now grappling with more than $1 billion budget hole that has specifically been caused by HR1. Now, Colorado is kind of a special case because apparently their state tax collection is linked to federal taxes. So the changes to the federal tax code automatically impacted the revenue coming into the state. So they're kind of a unique case there. But it does show you that this federal bill is really going to create problems that no one could have anticipated. And Colorado is, being very clear. They are holding a special session that is addressing this first impact. It's going to introduce this short-term initial almost $1 billion budget hole, and that they are expecting that there's going to be additional rounds of cuts that they have to make as they learn more about what additional costs are coming to them because of HR1. So again, states only have a limited amount of tools. Colorado is thinking about raising taxes, ending some tax incentives, cutting programs. You've either got to raise the amount of money coming in or lower the amount of spending that's going out. That's how you balance the budget. And this is, going to be the story for every state across the nation. And I put a quote in here from the governor just because I think it's important for us to remember how closely we are going to have to watch and how continuous our watching and commenting will be for the next several years. These are cuts that will be ongoing cuts. This is not just for the current year. Yes, they have a big surplus, but a surplus can't be used to solve budget problems that keep happening every budget cycle. Eventually, you use the amount of reserves that you have. So other states are starting to have those discussions. I will share with you that this week I had a meeting with all of my counterparts across the country in other states, and the story is fairly grim. And can, it varies from state to state what the situation is. My friends from North Carolina were particularly, in a bad place because their state legislature decided to cut the amount of state funding to Medicaid before the changes to HR1, which means if you cut your state funding, you also reduce your federal funding. And there are some states that are going to be in some really, really hard places when the amount of federal money goes down because of these cuts. Speaking of new changes required by HR1, we've talked a lot about Medicaid prove you're working and exempt requirements. And this is an article that really focuses on one aspect of why exemptions that are in the bill may or may not fit everybody who we think could qualify for exemption. This article is pretty clear about like who has the ability to decide what fits into some important definitions. Who's medically frail? What does it mean to have special medical needs? Those are definitions that determine who's going to be able to be exempt. And depending on how you frame those definitions, more people can fit into them, or perhaps many more people will not fit into them and be subject to prove your working requirements or the loss of their Medicaid coverage. This article is pretty clear, and I included the quote because it is something that we've seen as a pattern from the current secretary. There is a real message that's been consistent about viewing people with chronic disease as somehow at fault for having that chronic disease, and also being very clear about, linking work to being the what defines value of the person. And those are really old ideas, but I think they're particularly damaging for populations of people who do want to do as much as they can, but also have real limitations that are based on medical science and disability that impact how much they can do, and whether or not it is, at least 80 hours of work is not necessarily the level of what they can do. The article also is really clear about, the folks that may be most at risk for falling through the gaps and not ending up fitting into any exempt category from work requirements. And we know a lot of these people, right? There are lots of people who have some significant medical issues or disabilities that impact their ability to work or do other things, but they don't look like they're sick. And that could mean that some of the folks that fit that category may end up not being in an exempt category, but in required to prove that they are working. And there's also a lot of discussion in this article of, it isn't only that people, that the definitions could be too narrow to include all of the people who should be exempt. It also could be that you can make the proof that you are exempt so hard to do and so hard to obtain that a lot of people with disabilities who, would be exempt are just not able to provide enough documentation to qualify for the exemption. This week, there was an announcement that the U.S. Department of Health Services is going to have a committee about reshaping Medicare and Medicaid. It is really unclear about what they mean by that, but you can see again, who they're looking for is people with expertise in chronic disease management and, how do we manage the money, right? They did mention some policies. It's hard to know exactly what the outcome of these of this committee is. But certainly what I don't see here is any mention of improving, care and community engagement for people with disabilities and older adults. I don't see any mention of how do we make sure that we're, you know, shoring up the home and community-based workforce so we take the pressure off our nursing homes, or what can we do for home care that would be helpful to preventing hospitalizations. A lot of the issues that we would say are really important and would be impactful to driving down Medicaid and Medicare costs, I don't see in this list of things. I do see some, I don't, I always pay attention when I see the word structural opportunities, because that is looking for recommendations to really change how we manage Medicaid now. That's there. And also Medicare Advantage is on the list. So I kind of look at this committee. They are accepting nominations, for people to be on it. But I look at this list and I see it maybe as a continuation of some of the discussion that we've seen about Medicaid and Medicare from lawmakers the last 9 months. Also this week, there was a cabinet meeting that was about 3 hours long, and there's a number of articles that were made on that. I believe in May, the Secretary of Health and Human Services said, "Hey, we're gonna have a report out in September, and we're gonna identify the causes of autism and what to do with it and what to do about it." And at the time, a lot of people went, "That's a really short time frame." And also, there's a huge body of scientific research that has been asking those questions. And none of the people who are doing that research seem to be involved with this report. And there's certainly been a continual messaging from the secretary that he has a belief that vaccines are causal to autism. That theory has been scientifically disproven in multiple studies over a very long period of time. It has been a messaging point, but it seems like there is potentially a desire to make that link again. So, we will wait for the report, but I think folks should be prepared that we may already kind of know what could be in that report based on the comments and actions that we have seen before. At this meeting, the president described autism as a horror show. And this whole discussion seems to be oriented around how can we stop or prevent autism from happening, as opposed to recognizing that autism may be being diagnosed in a greater, more people are being diagnosed because the definitions have changed and people are looking for it more. And that is not part of the discussion. And the framing here is not about how do we support and improve, lives of people with autism. This is all about a very medicalized model of having autism is perceived as the worst outcome and should be prevented, as opposed to people have autism and it looks different in every individual, and there are lots of people who can be successful, and how do we create, the ways for as many people with autism to be successful. So I think, again, be prepared that some of the messaging you may hear from the federal government may be much more along the lines of very old and, I would say, ableist messaging as opposed to what disability advocates and many families and people with autism themselves have been talking about, really over the last 20 to 30 years. Tariffs have gone into effect. There was a good article about how does this impact drugs. Drugs are a major cost driver for healthcare costs in Medicare and Medicaid. And again, states pay for Medicaid. So if you increase the price of drugs, you are also going to increase the costs of programs like Medicare and Medicaid. And if you increase the cost of Medicaid, that means you're impacting the state budgets. Interestingly, there's a 50% tariff that went into effect on India, but pharmaceutical products, that's fancy word for drugs, were left out from immediate tariff enforcement. That doesn't mean that there won't be tariffs. It's kind of like a shoe dangling ready to fall. But I do think that's a recognition that the pharmaceutical industry has said, look, that's where most of our generic drugs come from. And if you put a high tariff on that, you are going to really be increasing healthcare costs. But that doesn't mean that there won't be increased costs for drugs, because these tariffs kind of, there are lots of countries that are part of the supply chain and how a drug is produced. And I think that the graph here is pretty good about showing you where prescription drugs and the ingredients that go into them are made. This is another kind of rolling impact. In March, we were covering the changes to the U.S. Department of Education. And you might remember that in March, 40% of the U.S. Department of Education Civil Rights Division staff was fired. 50% of their cases were about students with disabilities. And since March, that has meant there are a lot fewer people to do fewer cases. And over the last several months that we've been, covering, that there are lots of cases that would have gotten a review or would have had somebody worked on it who are just simply being closed or not worked on. This is another article that's talking about, here's the impacts now that we have very little capacity at the federal level for taking on cases where there's already been failure to address it at the state level. The federal government was always a parent's last stop. And now that last stop is effectively not functional, that really changes, how parents and students with disabilities can make sure that they have a right to a free and public education. And it also has been true that in many states, the state systems haven't been particularly good about helping parents resolve their issues. So, this is again another example of, removing the kind of ultimate enforcement tool at the federal level. It doesn't create capacity to do better work at the states. It just simply means it's harder for parents to work within systems that haven't been effective anyway. And it may mean that there are a lot more students and a lot more parents who aren't able to fully enforce their right to get an education. Public data has been a theme over the last few weeks. There was a whistleblower complaint formally this week that was announced that says, hey, Social Security information for 300 million Americans is somewhere on a private section of the agency's cloud, and it's not secure. This is again another continuing outcome of DOGE. Some of the same people who were, in DOGE, the Department of Government Efficiency, that was never really a department. In March, they came in and started, trying to consolidate a lot of or share data among a lot of federal agencies, and it's not been very clear about, what protections there are or whether they're in compliance with federal privacy laws or what's happening with the data, and who has it once it's been kind of, released into the wild. But this is pretty significant because most people in the country have a Social Security number. So this really impacts all of us, whether or not you have a disability or not. But it does put a huge risk on people that are really dependent on Social Security, because should there be anybody who gains access to that, or steals identities or other things, that could be the difference between somebody, losing access to Medicaid or food share or other things, due to no fault of their own. It is unclear what this information is going to be used for. We had last week we talked about, the Medicaid data potentially being shared with the Department of Homeland Security. We've talked about, the Department of Homeland Security wanting access to state voter rolls. It's overall a pattern of trying to see and marry different data systems that have information about people who are interacting with various programs, and it is not clear what the ultimate goal of, sharing all of that data is, nor is it clear who has it, whether there's a copy, and how it can be, how it can be used by non-government actors. We also talked last week about the effort to, President Trump had asked the Texas state lawmakers to redraw their district maps early for the purpose of creating more districts that would elect Republicans to the U.S. House of Representatives. That it's very clear that there was a line that the president was drawing, which said, I would like a bigger majority in the House of Representatives. And if you redraw your maps a certain way, we think that that will mean we can predict that there will be more elected officials that are Republicans. Texas did do that. They finalized last time we talked. I think their House had passed the bill. The Senate and the governor have signed it now. Now the focus has moved to Indiana. Indiana, there were a number of people in the state house that were not super comfortable with redrawing the maps. It looks like the administration is continuing to ask Indiana to redraw their maps, and that conversation is making Indiana lawmakers more comfortable with changing their maps. In addition, on voting issues, the Department of Homeland Security is threatening to cut off, federal funding to states for election security if the states aren't in compliance with the administration's voting policy goals. Last week, we covered two posts that President Trump made on Truth Social, which called for the end of mail-in voting ballots and unspecified changes to what kinds of voting machines could be allowed. And the connection that was made in those posts is that somehow voting machines and or mail-in ballots were not as legitimate in terms of voting outcomes as other methods. In other words, the president seems to be identifying certain ways of voting that he would like to see people have fewer options on how to vote. And certainly the Disability Vote Coalition has been very assertive in the last 10 years to say there should be as many options for people to vote, and specifically having good accessible voting machines as well as mail-in voting options are important to people with disabilities and older adults, many of whom are on non-drivers or have conditions that make it not easy to predict whether they will be able to make it to a polling place on voting day. So he was threatening to issue executive orders. That hasn't happened. But again, the statement of the policy goals have definitely been noticed by federal agencies. And this is an example of, even when there isn't an executive order, even when that executive order would, if it were issued, would not have the effect of law, the ideas behind the policy are getting implemented in other ways. And this is one of those ways where, a federal agency is saying, hey, we'll give you the money if you change your voting laws or you change the way you do things in your state. And if you don't, then we won't give you that money. Another development in the voting realm is there's a new appointee that is overseeing the nation's election infrastructure. And this particular person is well known because they've been very public about making misleading claims about vote counts or voter fraud, and spreading conspiracy theories about elections that where the outcome wasn't what this individual wanted, right? And she's also had pretty big roles in organizations that want to let fewer people vote. So the groups that are thinking about how do you change laws so that it's going to lead to fewer people having less options on how they can vote. She is now in charge of overseeing election security. And again, the Department of Homeland Security has a role on helping states protect their information technology infrastructure and voter databases from foreign intrusions. A lot of experts on voting and state election officials are not seeing this appointment as a good sign. And they are also noting that almost all of the Department of Homeland Security capacity to protect election infrastructure was cut in the spring, as I think as part of the DOJ cuts. So, taking those pieces together, thinking about the desire to restrict mail-in ballots and voting machines, lots of election officials are kind of seeing a pattern here of you're saying what you want the policy to be, and now we're seeing some changes and some people in place that we worry will impact, how states are able to do elections. More coverage of the impact of the reconciliation bill. This article is particular to tribal nations. Medicaid is extremely important to tribes, and partially because the Congress has historically not funded the Indian Health Service to the degree it needs to. So Medicaid is actually the payer that fills in those gaps. And what technically under HR 1, Native Americans are exempt from the prove your working requirements and more frequent eligibility checks. And this is really an example of you can be exempt, but that exemption may not help you if you can't prove it, or if your state agency and the database that is supposed to identify you as exempt doesn't do their job correctly. So this article is highlighting that Native Americans are extremely vulnerable to being missed and being disenrolled from Medicaid by procedures, and they highlight what happened just a couple years ago when the policies that were part of the COVID era, like nobody got disenrolled for a while during the global pandemic. That was actually something Congress said should happen, that if you were in Medicaid, you didn't have to do the renewal and other things. It was, and that was a strategy to say, like, let's not create paperwork problems that impact whether people can get care in a global pandemic. Well, after the pandemic ended, those policies of continual enrollment without checking whether somebody still qualifies, sunset. And states had to do a lot of work to look at everybody in Medicaid, and reevaluate whether they still met the eligibility criteria to be there. It was a big administrative task, and there were a lot of mistakes made. There were many, many, many people who were disenrolled by states and found out that they lost their Medicaid coverage, who actually still were eligible. So, and it happened a lot to Native Americans. There are about 2.7 million people, Native Americans, were enrolled in Medicaid in 2022. In 2024, after that, they called it Medicaid unwinding, but after they stopped doing the policies that had been in place for COVID, almost 850,000 Native Americans had lost coverage. So there is a population, yes, they are exempt, but they are also uniquely vulnerable to procedural disenrollment, for a number of reasons. And some of them are due to living in rural places or not having street addresses associated with reservation properties, or not having permanent housing. Some of those things are not exclusive. There are many other people who are not Native American who also experience some of those same barriers. One of the other things that's a challenge is, again, you're exempt, but you have to prove your exemption. And, historically, many Native American tribes have not wanted to provide states with the names of all of their tribal members. And so it can be difficult to identify, who is a member of a tribal nation, and what does it mean if you're exempt from these requirements? Are you going to have to prove that? That's a question that this article doesn't cover, but I think it is, again, it makes it more complicated for this particular population of people. And an example of, you can be exempt, but that doesn't mean that you necessarily will have uninterrupted or no problems getting Medicaid. And it doesn't mean that you won't have to prove your exemption, perhaps in a way that might not be, appropriate. This is an opinion piece, but I think, again, I mentioned North Carolina and my colleague being very concerned about what is happening there. So it's a long piece, and if you're interested in knowing what's occurring in another state, it's a good kind of primer on that. But I think the message that this mom is making is very, very similar to moms across the country, that, the recognition that Medicaid plays such an important role in the lives of kids and families where there's somebody who's medically complex or needs lots of care. And they are certainly looking at, we're the most expensive people who are in this program in an environment where our state just created $1 billion Medicaid hole before cuts from HR 1 are set to come in. For folks who are really interested in the Affordable Care Act and healthcare costs in general, this article shows you that it's not your imagination that healthcare costs keep going up and going up a lot. If you're curious, since 1999, which is a little less than 30 years ago, the healthcare costs have quadrupled, and they're going up by 6% a year pretty recently. So in the Affordable Care Act rates, that's an employer-sponsored insurance. Affordable Care Act rates have probably risen more dramatically. And the actual costs of healthcare are really going up in a tremendous amount. We've talked a little bit about how healthcare is an ecosystem. Lots of people have employer-sponsored healthcare plans. Many people do not. They have either Affordable Care Act marketplace plans, or they're in Medicaid or Medicare. Those are kind of the four main things, or they're uninsured because they aren't anywhere. But the important piece here, I think, is as you have Medicaid cuts, as you have more people who find it harder to afford marketplace plans, as you have more people who are uninsured, the payer mix that keeps the healthcare system going is starting to be unstable in multiple areas. If Medicaid isn't paying enough, or isn't, there are lots of people who were covered in Medicaid who aren't anymore, who are being uninsured. If there are people in marketplace who can't afford their plans and are uninsured, or the marketplace premiums go up and cover less, that means that employer-sponsored insurance is also going to become more expensive. And for many people, the plans are going to start to cover less, right? If everybody wants to pay less, but the healthcare costs keep going higher, and you don't have Medicare, Medicaid, Affordable Care Act marketplace insurance, or employer-sponsored plans willing to pay the bill, the only other person who pays that bill is the person who has the insurance. That's us. That's the consumers. And we can't afford it either. So this is just another example of, cuts over in one place actually do destabilize and ripple out across everybody who needs healthcare. Yes, you'll be paying higher premiums. Yes, you'll be paying more deductibles and copays, and maybe your plan covers less than it used to. And if you need it to cover something that it no longer does, that probably means that you're going to be paying for it out of pocket. And we are starting to see a lot of, especially older adults and low-income older adults, really starting to wrestle with, can I afford this marketplace plan that's going to be a lot more expensive? And how long can I afford to do that? Especially if I'm under 65, which is when Medicare kicks in. So, I think that these kinds of calculations are starting to happen in communities across the country and in Wisconsin. And all of those individual choices are going to end up translating into higher premiums and healthcare costs for everyone, more uninsured people, and also state budget holes in places that we wouldn't have necessarily thought would happen when, you have more people leaving the marketplace, or other costs going up, and state budgets kind of getting caught on the back end, not realizing what's happening. Next week, we will be doing a webinar, but it won't be live. I have someplace I gotta be next Friday. So I will try and get together some slides, and I will do a recording on Thursday, because I expect that there will be a lot of things happening. And we'll pre-record it, and you will get an after message on Friday. So sign up and you'll get everything. It just won't be live. And then after that, we'll keep going, because I think we're going to see things start to really ramp up. And I thought August was supposed to be the slow month. It was not. So we'll see what September brings, but I think it's going to bring a lot of things. Sally, are there any questions that are
just a couple,
queue?
but you really answered them. One was about agencies getting the money they're owed, and you talked about that, but I included, if there's a particular program that somebody's using and you know they haven't gotten their funding, then you should talk about that with your legislator to tell them, you know, this program has not gotten their money and this is how it affects me. Um, you know, just talking about what RFK might come out with, and, you know, how the community can step up. There was a question about 504 and can DPI, you know, do those 504 complaints. And, you know, it clearly says on their website, you know, that they don't have the authority, but again, a very good question. And, you know, I think that's something we could probably pose to them and maybe let people know in the future. Just because what are they going to do? DPI does have to take discrimination complaints. So, you know, whether that, you know, falls under that, it's kind of an unknown, but they do have to consider discrimination complaints at some level. And then someone had already contacted their legislator about the release of the data and specifically asked them to look into their own data and their adult daughter's data. And I was saying that recently I saw someone use the language of opening a case when you're calling your federal legislator to say, I'd like you to open a case into this, and maybe using that language. But that was it. Not too many questions.
Yeah, that one of the it's I'm sputtering. There's so many things. That language of I'd like you to open a constituent case for me with Congress is something that's being talked about in national circles. And
Yeah,
I
that's where
don't
I
think it's a
saw
bad,
it.
it's not a bad idea to in theory, every local congressional office does constituent services, and that is a way for constituents to call them and say, "Hey, this is happening to me. I want you to open a case." And I would just suggest, and you could do that about a lot of different things. I think the data piece, it is important for them to hear how many people are concerned about who has that and what is it being used for, because I can come up with a lot of things that I don't necessarily think are great ideas that you could use it for. I also think that there are a lot of lawmakers who have zero idea of how many programs haven't received 2025 funding. My only suggestion is also to contact your state lawmakers and say, hey, I have asked my congressman about this, but I want you to know about this local program that hasn't gotten its money that I use, because state lawmakers don't know that either. And I do think it's with the volume of inaction and action that is happening, there isn't one place to go like, okay, here's the money that was appropriated, how much of it went out, and did it get to where it needs to go? So you're doing a service in that respect.
Absolutely. But that's it.
Okay, well, I hope everybody has a wonderful long weekend. I feel like we have been running a marathon together, and I kind of always feel like we're getting to the end of the marathon, and then we just keep going because we're strong. So we will get the after message and recording out to you, and the slides, and feel free to use them however you want. And hopefully we will be back next week. Maybe we'll have a week with very little to talk about. We'll see.
I did also put in the chat the link for the survival survey in
Thank you.
English and Spanish. So if people didn't grab that, I'll give you just a minute before we close up to grab those links. But those are also on our BPD website, so you can always go there too. So
Okay.
I'll just hold for just a minute so people can maybe do that, and then I'll end it. All right, everybody have a great weekend. Bye-bye.